You're all very welcome. So my name is Esther-Mary Darcy, and I am chair of the Europe region of World Physiotherapy. Just in mentioning a little bit about the background, many of you are aware, the OCD has really concerned, as many people are, is that the mental health issues are representing a major and a growing public health, social and economic challenge across Europe. And indeed, the OECD has estimated that poor mental health costs European economies approximately 76 billion euros per year. This is mostly due to reduced productivity, obviously reduced workforce involvement or participation, and increased healthcare needs. As you all know, mental health conditions also worsen outcomes for people with physical illnesses as well, and thereby increasing the overall healthcare costs. So the current evidence is showing high prevalence, widening inequalities, and increasing pressure on health systems. Within Europe, among the countries, there are differences in prevention services, in access to care, and the overall health system capacity. And then even within a country, there is unequal access to mental health services. And I'm sure this is the same in India and the US and other countries where you're joining us this evening. So the role of physiotherapists in mental health, I'm very glad to say, is expanded. It's supported by growing scientific evidence showing the really positive impact of physical activity and movement-based interventions on mental health outcomes. It is an established specialty practiced across diverse health and mental health settings, including psychiatry and psychosomatic medicine. Services are provided across the lifespan, from children and adolescents right through to older adults, and indeed for people with mild to severe, acute or chronic mental health conditions. So we really provide a vast array of services for people with mental health conditions. And then just moving on to the webinar this evening, it's a two-part webinar. It's going to start with Cristina presenting the main results of the survey. And this is a survey that has been undertaken by this mental health working group of the Europe region of World Physiotherapy. And I'd like to thank them for the work that they have undertaken. And the results will show the current status, integration and challenges of physiotherapy in mental health across Europe, focusing on the mental health services that we provide or that we don't provide, and indeed the education. Okay, so these findings will be helpful to member organizations in their national advocacy efforts, and indeed it will assist the Europe region with its strategic planning to advance the profession. The second part will be delivered by Aline from our Advocacy and EU Matters working group, and it will focus on how to advocate for physiotherapy in mental health, identifying the challenges and the barriers that there might be. But it's also aimed to offer practical strategies to promote and strengthen its future development across Europe. And this is great piece. I love this because this is a combined piece of work between the Mental Health Working Group of the Europe region and the Advocacy and EU Matters Working Group. So really to try and promote the importance and the extent of the work of the Europe region.
Good morning. Today I will present the main findings of our recent survey on the status of physiotherapy mental health across Europe. This work reflects a collaborative effort from multiple member organizations and aims to provide an overview of where we currently stand, as well as the key challenges and opportunities ahead. To achieve this project, we developed a survey consisting of 19 questions. It was distributed in July 2025 to 38 members organization of the Europe region of World Physiotherapy. We received responses from 33 organizations, which represents a very high response rate of 89%. The data were analyzed in November 2025. This high participation provides a basis to understand the current landscape across Europe. The survey covered four main domains. Legislation and advocacy was first, education, clinical practice, and recommendations from member organizations. These domains allow us to capture both structural aspects and future-oriented perspectives. Starting with legislations, we observed significant variability across countries. The first question was whether national legislation recognizes physiotherapy in mental health. The results showed that in many cases, physiotherapy in mental health is not formally recognized as a specialty or defined area of practice. This lack of recognition has important implications for service development, funding, and professional visibility. With regard to the question on whether member organizations have a special interest group, the results were divided. Half of the countries responded that they did, while the other half reported that they did not, around the half of the respondents. Regarding the main challenges that reported were a lack of recognition of role and insufficient funding for physiotherapy in mental health was two main responses in this question. When asked about barriers, half of the member organizations said that none existed, while the other half reported that barriers include limited professional recognition due to the lack of legal framework or specialty status, financial barriers from insufficient insurance or public coverage, restricted professional autonomy, require referral or supervision, limited availability of specialized education in mental health physiotherapy, and low visibility and integration within healthcare systems. At the same time, many countries are actively engaging in advocacy efforts, including policy engagement, active lobbying, and political support, collaborations with universities and health organizations, participation in international networks such as EOPTMH organization, and awareness initiatives through conference and social media. The main areas for developing physiotherapy mental health were improving public awareness of the role and expanding undergraduate and postgraduate training programs. Other areas of development include the physiotherapy role in national guidelines and mental health legislation. Also, formalized collaboration within psychiatric and mental health service frameworks, or advocacy for increased funding and resource. And at last, physiotherapy mental health is not being developed in the country, on another question. In terms of education, the results show that a wide range of training programs can be found across many countries. The most common formal training were specialized technique training and undergraduate course, was two main responses. However, these programs are often heterogeneous and not necessarily organized as specialized training. The most common competencies were general awareness and basic clinical training. When asked about the resources or training provided by member organizations, 19 countries responded negatively. Of those who responded yes, the support reported included digital courses, webinars, workshops, and national conference. You can see all the map and the responses. In general, the physiotherapists are interested in developing their knowledge of physiotherapy mental health. Only 8 countries report low interest in that field. When asked whether physiotherapy is part of the national standard or clinical guidelines, 24 countries answered yes. However, it's unclear whether physiotherapy in mental health is included. The inclusion of physiotherapists in multidisciplinary mental health team is widespread, with 21 of the countries indicating their participation. Of those working in mental health, 78% are employed in psychiatric hospitals, 56% in rehabilitation centers, and 53% in private practice. This is the distribution of the professionals employed. When asked about the population served by physiotherapists working in mental health, the majority of respondents said that it was the adult population, followed by the elderly and children and adolescents. And the recommendations from member organizations can be summarized into 5 key dimensions. Education and training, international training opportunities, specific postgraduate programs. It should be interdisciplinary. Training in cognitive behavior therapy, exercise-based interventions, and trauma-informed approach were identified as a priority. Regarding clinical practice, development of European evidence-based clinical guidelines, strengthening interdisciplinary collaboration, and formally integrating physiotherapists into multidisciplinary mental health teams were also repeatedly identified as essential steps. And regarding professional development, funding opportunities to support projects in this field, also defining core competence advocacy for inclusion in national mental health policies in order to standardize specialized recognition and developing shared outcome measures. Regarding professional promotion and advocacy, inclusion of physiotherapists within national and European mental health strategies, European level awareness campaigns to highlight the role of and impact of physiotherapists in mental health, targeting policymakers, healthcare professionals, and the public, development of information sheets and educational materials. And the last domain was recognition of physiotherapy-specific approach, emphasizing the value of physiotherapy-specific approach such as body-mind interventions, psychomotor physiotherapy, movement-based and body-oriented therapies, economic recognition and reimbursement of these interventions within mental health service were clearly articulated. As with any study, there are limitations to consider of this study. The lack of formal questionnaire validation. The questions were developed by the group and is not validated as a study, as a scientific study, only survey. There may be some response bias by potential sampling. Contextual and generalized ability constraints is limited, and the data are self-reported, and this is another limitation of that study. Finally, however, despite this limitation, the study provides valuable insights at a European level. And finally, the recommendations from that study was ministers of health and relevant regulatory bodies should consider establishing formal legal recognition of physiotherapy in mental health, either as a statutory specialty or as a clearly defined area of advanced practice. National reimbursements schemes and insurance frameworks should be reviewed to ensure coverage of physiotherapy intervention in mental health settings, including public, private, and community-based service. the development and expansion of dedicated undergraduate and postgraduate training programs in physiotherapy for mental health are essential to ensure a competent and confident workforce. Institutional visibility and policy integration are needed. Collectively, coordinated action at institutional, organization, educational, and ministerial levels is necessary to address these barriers and to fully realize the potential of physiotherapy in mental health across Europe. And this is all. Here we are all the members of mental health working groups that work in this survey in this term. And thank you for attention.
I will speak about political influence in a positive sense and how we can use it in physiotherapy, especially in mental health. My goal is to share a few simple ideas and practical directions because even with limited resources, it is possible to have an impact if we are strategic and choose the right moments. Politics shapes physiotherapy. The real question is who shapes politics? If we are not involved, others will decide for us. In public affairs, we need to be smart, be precise, be strategic, and choose the right timing. With my colleagues, we like to use a simple image. In politics, you can be like parsley or like chili. Parsley is everywhere, it looks nice, but it does not change much. Chili is different. It comes at the right moment and it changes everything. So our goal is clear. Do not just be visible, be useful. Act at the right moment in the right place. In public affairs, we first require a strong professional expertise. This means we must rely on data and evidence. We must collect information, use studies, and understand real-world results. Without this solid knowledge, our political messages are weak. With it, we become credible and trusted. Then, we must structure our work in two parallel directions. First, political and media work. This means speaking with decision makers, following political processes, and working with the media to shape public conversation. And second, internal and external communication. We need to bring our members together, explain what is happening, and create a common voice in our associations. At the same time, we must also inform the public in simple and clear language. So we work on three levels altogether: expert knowledge, political and media action, and communication with members and the public. When these three levels are well connected, our impact becomes much stronger. In public affairs, it is very important not only to speak, but also to listen. We must listen carefully to decision makers. We must understand their situation, their limits, and their priorities. Politicians and administrators work under many constraints, limited time, political pressure, and many different topics. They also follow their own agenda and objective. Then we can adapt our messages. We should not only present our ideas, but also show how our topics can help decision makers reach their own goals. In this way, they can take ownership of our themes and bring them into the right political and legislative processes. We also must work with journalists. Media professionals also have their own priorities, deadline, and editorial lines. We must help them understand our topics in a clear and simple way so they can explain them to the public. Therefore, effective public affairs work relies on coordination and good timing in relation to political and media agendas. Activities in public affairs for physiotherapy in mental health come with specific challenges. Physiotherapy in mental health is still a niche topic. Many people do not know enough about it, and it is not seen as a priority in health policy. Mental health is still a taboo subject in many situations. People may not speak openly about it, and this can make political discussion more difficult. And we know that mental health problems are a major issue in society. They affect many people, families, and workplaces. This creates a paradox. The problem is big, but visibility is still limited. For public affairs work, this means we face these main challenges. We need to make the topic more visible. We need to explain it in a simple and clear way. We need to show that physiotherapy can be part of the solution. To do this, we must combine evidence, communication, and political work. It's really that easy to be strategic. Every society works within a political system. This system is shaped by its history and its culture. So there is no set recipe. We have to work out the process for each specific situation. And this is where the real work starts, not the fun part. It is called monitoring and stakeholders mapping. Monitoring means we read, we follow, we listen a lot. It is not that easy to get the monitoring just right. If it's too broad, you lose time. If it's too narrow, you miss connections. Stakeholder mapping means we try to understand who is who has the power, who decides, who influences, who agrees, and who does not. Honestly, this takes a lot of time and energy. Sometimes it is not very exciting. But it is a bit like preparing a good meal. If you skip the preparation, the result is not great. If you do this work well, everything else becomes easier. If you know where to go, who to talk to, and when to act. So yes, it is a lot of work, but it is what makes a difference between guessing and really influencing. To conclude, I hope I have shown that public affairs is not only about politics, but also about strategy, timing, listening, and communication. To become chilly in public affairs, we should be persevering. We cannot rush the process. We also have to taste again, to adjust, to learn, and sometimes to correct the recipe. As Physiotherapy Association, we must shift our mindset and act as an interest group. If necessary, don't hesitate to call on public affairs professionals. Thank you very much for your attention. I will be very happy to answer any question you may have.
Ellen Anderson is the secretary of IOPTMH. So if you would like to tell us 2 words.
Yes, I was very interested in the report. It's important for us to realize what the status is, as well as the challenges, the barriers, and the suggestions that were offered, not just for the European region, but for the entire world. I can speak specifically to the United States, in that we do have some significant challenges and barriers for integrating mental health into physical therapy because of the way that our health insurance and reimbursement system works. And in particular, the organization within the United States is working towards training and education and advocacy so that we are able to provide some information and some data that supports the fact that physical therapists are indeed providing some mental health aligned interventions, because our patients are not only receiving or benefiting physically in a physical therapy encounter, but they're also benefiting from a mental health standpoint. So the more information that we have from other regions of the world can very much inform the work in the United States and in other regions. So I thank you very much for the work that you're doing in the European region.
Thank you. Cristina, I have a question for you. Does the working group intend to repeat this survey over every so often in order to see that hopefully there's a kind of an improvement in the involvement of physiotherapy and the training and the integration? I just wondered, I guess this is a baseline one. Do you intend to repeat it?
Yes, I think it's wondering, it will wondering that could be repeated, but I think it's necessary actions before. The main action, I believe that is education training and establishing the basis for education training more commonly around the world. And in this regard, I think IOBTMH are doing a great job, as say Ellen, to establish these guidelines for curriculum of programs around the world. And then I think with physiotherapists more trained in this field, it could be better, the integration of physiotherapy mental health in the healthcare system. Different countries have different healthcare systems, and not in every country had the possibility. We have the possibility to integrate the role in the same way. But we have the possibility to training all the physiotherapists in the same way and created a workforce for this pandemic situation, I think.
Thank you.
And if I may add about the survey, I'm Katri Partanen from Finland, and I'm the chair of the mental health working group. And there's a report from the survey, and it will be released after Europe Region General Meeting, which will be next week. So sometime after that, it will be uploaded to the Europe Region's webpage, and there you can find more detailed information about the survey.
I want to ask to Aline if this kind of surveys are developed in other settings around physiotherapies, or maybe physiotherapy mental health is the first time that do this kind of survey in Europe. I don't know if you know, Aline.
I really don't know this kind of survey.
I could come in there just to
Yes.
say, yes, Cristina, over the years, we've done several surveys to look at different areas of physiotherapy, but this is the first time we've done a mental health one, and I'm really very pleased to see that, because I think that this is a great sort of foundation for us to work on and to assess the needs. And as Aline said, it gives us the evidence then to move into the PR and the public affairs aspect of it. So definitely a first for mental health, but not for other areas. If I may, I have a question for Aline. I really liked that idea of the parsley and the chili. I just wondered if we're trying to move from the parsley to the chili, what do you think is the first thing we have to do? I think you outlined a really beautiful presentation in terms of what we need to do, but if you were just to prioritize one thing for that conversion, what would you advise us to start with, I guess?
I think, from my point of view, physiotherapy associations are used to write position paper and assume that this position paper will be read from policymaker alone. So it will come on the table of policymaker from the sky. And
Okay.
and it is really not enough. And I think we are not used to structure the work on the political level to try to inform, but also to influence, but in a positive sense, and to try to influence policymaker. It is necessary. It is wanted. It is necessary for the democracy functioning. So I think physiotherapy association has to assume this mindset of being an interest group. And for niche topics like mental health, it is really, really necessary to have a good strategy.
Thank you very much. And Stavros, I see there's a question there from Justin.
Justin asked, I wonder if there are any resources or suggestions on how member states can commercially access the status of mental health care and physical therapy within their borders.
The status of mental health care and physical therapy within their borders. It's difficult to answer because every country has their status, their own status. I think in the same line as Aline said before, the National Association of Physiotherapy Mental Health had the connection with politicians, not and policymakers, and be in the main tables of discussion about mental health healthcare. I can explain about Spain, but I can explain about other countries.
Cristina, do you think that the current survey, which is surveying countries, could actually be adapted to be used by physiotherapy organizations within their country? And perhaps that's what Justin is maybe thinking about. Yeah.
Yes, I think so. And also in Spain, we publish an article, a scientific article with a survey similar that we are done in European region about Spain and professionals of mental health care, and about beliefs and beliefs and perception of the role of physiotherapy in mental health. And I think it's a good job to do, to develop in each country for each association of national association. Yes, and several researchers asked me for that questionnaire, and it's easy to find in PubMed and other sources. And I think it's interesting to have an idea which is the state of physiotherapy and mental health in each region. Yeah.
Okay, maybe if there is no more questions, maybe I will wrap the webinar up with some comments. So, like I said, I'm a chair of mental health working group and also the executive committee member of Europe region of World Physiotherapy. And I want to thank all the working groups members for their hard work to bring physiotherapy forward and help citizens, and also to promote physiotherapy in mental health and advocacy, what can be done by member organizations and all the physiotherapists in Europe and all over the world. It is very important to promote physiotherapy in the treatment of mental health problems. And as the prevalence of mental health problems continues to increase, and there is evidence that physiotherapy is really beneficial. So it's truly important and essential to promote its use as a part of healthcare for mental health conditions, both in primary care and in specialized health services. It was already said that across countries in the Europe region, social and healthcare legislation is different and services are organized in different ways. So that we have to take in account when we make the advocacy. Also, physiotherapist professional rights and education and scope of practice varies in different countries. For this reason, it is important that we identify the focus areas and ways how we can promote the use of physiotherapy in mental health care as an integral part of health services. So I think this survey has a step forward to promote physiotherapy.
It's a real pleasure to conclude. We hope that everything was a productive meeting. So to the next. Thank you very much.